Can AFib just go away on its own? Yes, but there's a catch that could put you at serious risk if you miss it. Because not all of AFib is the same, and your type changes everything. And if you want clear, honest answers about heart health every week, hit subscribe because your doctor only gets 15 minutes, and I have got much more to share. A landmark study published in the New England Journal of Medicine looked at 437 patients who arrived at the emergency department with recent onset AFib. This was the RACE-7 ACWAS trial. Instead of immediately shocking their hearts back into rhythm, researchers gave patients rate control medication and simply waited. The results were remarkable. 69% of patients converted back to normal rhythm within 48 hours, with no cardioversion at all. Nearly 7 out of 10 people, their hearts reset on their own. And at 4 weeks, 91% of the wait-and-see group were in a normal rhythm, compared to 94% in the immediate cardioversion group. No significant difference between the two approaches. Only 6.3% of patients ultimately needed electrical cardioversion when given time to convert naturally. So yes, AFib can absolutely go away on its own, but who converts most easily? Research has identified several key predictors. First, if this is your very first AFib episode, you are 4 times more likely to convert spontaneously compared to someone with recurrent AFib. Second, duration matters enormously. The shorter the episode, the higher your chance that your heart resets itself. And episodes lasting less than 48 hours have the highest spontaneous conversion rates. Third, the size of your left atrium plays a major role. This is the top left heart chamber, which is critical to the genesis of AFib. 78% of patients with normal-sized left atriums converted spontaneously. That number dropped to 38% in patients with an enlarged left atrium. Fourth, how well your heart pump matters enormously. If your ejection fraction is normal, the spontaneous conversion rate is 72%. With reduced pumping function, that drops to 40%. Fifth, the presence of diabetes lowers conversion rates significantly. Patients without diabetes converted at 69%. Patients with diabetes converted only at 38%. And sixth, a slower, chaotic electrical rate inside the atrium, what cardiologists call a low atrial fibrillatory rate, was associated with a 3.7 times greater likelihood of converting on its own. Now here is where things get even more interesting. A 2019 study published in the Journal of the American College of Cardiology followed 205 patients with subclinical AFib. These were patients with AFib detected by implanted heart monitors, tiny little devices placed under the skin that track every heartbeat around the clock. 22% of these patients experienced complete spontaneous remission, meaning no AFib was detected for at least 6 months of continuous monitoring. And 55% of patients actually had less AFib in the second half of monitoring compared to the first half. The RACE-5 study added to this. Essentially, 16% of paroxysmal AFib patients showed regression over time, meaning their AFib burden actually decreased without any rhythm control intervention. This is real. Spontaneous remission happens, but it was less likely in patients with high blood pressure, previous stroke, or heart failure. Now, let us talk about a category of AFib that gives patients the most hope. AFib triggered by a reversible cause. These are situations where treating the underlying problem may eliminate AFib entirely. The first is hyperthyroidism, especially in female patients. This is a lab that any provider has to check when first encountering a patient with AFib. When the thyroid gland is overactive, it can drive the heart into AFib. Once the thyroid is treated and hormone levels normalize, AFib often resolves completely. The second is acute lung problems, pneumonia, a pulmonary embolism, which is a blood clot to the lungs, or other sudden lung conditions can trigger AFib. Remember, the right side of the heart pumps against the lungs, so anything affecting, the lungs, by that relationship can affect the heart. Once the lungs heal, the AFib may not return. The third is what cardiologists call holiday heart syndrome. Binge drinking, even in people with no prior heart history, can trigger an AFib episode. Patients who stop drinking often find the AFib resolves and does not come back. The fourth is post-surgical AFib, especially cardiac surgery, such as a heart bypass or any sort of heart valve replacement. This is very common after cardiac or thoracic surgery. In most cases, it is self-limited and resolves as the body heals. The fifth is inflammation of the heart. Conditions like pericarditis and myocarditis can trigger AFib. As the inflammation clears, the AFib often clears with it. And however, I want to be direct with you here. So the 2014 AHA and ACC HRS guidelines caution that there are very few data to confirm that patients with AFib from these reversible causes are truly cured after treatment. Recurrence is still possible. Monitoring must continue. Now let us talk about the most empowering part of this entire conversation, because this is where you have real control. Aggressive lifestyle modification does not just reduce AFib. In some patients, it actually eliminates it. The legacy trial showed that patients who lost and maintained at least 10% of their body weight had 6 times greater likelihood of being completely arrhythmia-free. Let that sink in. 6 times. The reverse AFib trial went even further. 88% of patients with persistent AFib who lost 10% or more of their body weight either became paroxysmal, meaning their AFib comes and goes, meaning shorter, less frequent episodes, or had no AFib at all. Alcohol abstinence also makes a measurable difference. Patients who stopped drinking showed significantly lower AFib burden over 6 months of follow-up. And optimal risk factor control, managing blood pressure, treating sleep apnea, and controlling diabetes was associated with up to 40% of patients maintaining a normal sinus rhythm without any rhythm control medications. These are not small numbers. This is medicine-grade evidence for lifestyle changes. The research is telling us something powerful. Your daily choices have a direct biological impact on whether your heart stays in a normal rhythm or continues to go into AFib. This is not a motivational phrase. This is pure clinical data. Despite everything I just shared, the overall natural history of untreated AFib is one of progression, not resolution. There's a concept in cardiology called AFib begets AFib. Every time AFib occurs, the electrical and structural properties of your heart change. The atria remodel. Scar tissue develops. The electrical pathways become more chaotic. And with each episode, the heart becomes more and more vulnerable to the next one. Think of it like a path through a field. The first time someone walks through it, the grass barely bends. Walk that same path every day, and eventually it becomes a permanent groove that is very difficult to reverse. Without intervention, only 20 to 30% of patients remain in normal rhythm 1 year after a cardioversion. Between 11 and 15% of paroxysmal AFib patients progress to persistent AFib, which is AFib all the time, within just 12 months. Many patients feel their AFib has gone away because their symptoms stop. But subclinical AFib, AFib with no symptoms at all, is extremely common. During a silent episode, blood can pool, form a clot, travel to the brain, and cause a devastating stroke. This is why early action matters. Lifestyle change and consistent monitoring are most effective before significant remodeling has occurred. Here is what I want you to walk away knowing. Up to 70% of recent AFib episodes convert on their own within 48 hours. 22% of subclinical AFib patients experience complete spontaneous remission. Reversible causes like thyroid disease, alcohol, and surgery may eliminate AFib, but monitoring must continue. Losing 10% of body weight, stopping alcohol, and controlling risk factors can dramatically reduce or eliminate AFib burden. Without action, AFib tends to progress, and the earlier you act, the better your outcomes. And most importantly, do not stop your anticoagulation medication without talking to your doctor first. Recurrence is common, often completely silent, and the stroke risk remains even when you feel perfectly fine. You are not helpless. Your lifestyle choices and your relationship with your cardiologist can dramatically change the trajectory of your entire life and condition. Share this with someone you love who has AFib. Visit fightafib.com to download your completely free patient guide that I made for you. Subscribe so you do not miss my next video on the lifestyle interventions with the strongest evidence for long-term AFib remission. I am Dr. Yasser Rodriguez. Stay informed, stay heart healthy, and I'll see you in the next one.